Welcome to the Movement Minutes with your host, Reed Nellis. Here, we pursue the human connection. We learn how to empower one another. We discuss clinical pearls. We discover our passions. We reflect on our capacity to achieve. We remain open to novel trends and concepts, because regardless of our backgrounds or experiences, our successes or failures, we all speak the same language: human movement. Welcome back. As I re-kickstarted this podcast idea, one of the first people that I wanted on really badly was Dr. Joe LaVacca. So, of course, I reached out to him first. He was my goal. I needed Joe on here, and I'm super excited about the conversation that we had and how we can bring that to you today. Topics discovered and talked about is compassion and emotion as it relates to our clinical care. How we can educate and empower and communicate with somebody better to create an alliance, to create a relationship so that they are actually able to achieve their goals. We also get into a little bit of continued education. Joe is a part of Rock Tape and our Rock Tape family. He also has his own content coming out, top down, bottom up, with Dr. Courtney Conley, who's also been a guest on the podcast, as well as some cool listening to pain and pain science continuing education courses as well. Joe is also a part of a fringe company called Fringe CBD that is thinking on fringe ideas. Very aptly named. So we get into CBD and the research behind it a little bit, the excitement about the entire industry as a whole, and right for now at least using plants as a vehicle to get people thinking a little bit more on these fringe ideas of the healthcare world, but how that's going to translate into more and more fringe or outside outlier ideas. So again, very excited about the conversation that we had with Joe. And without further ado, here's Dr. Joe LaVacca. All right, everybody, we got Joe LaVacca here. Joey, Dr. Joe, JoJo. I don't know how many other nicknames you've got. I feel like I say them all every time I talk to you, but like it's just, you're just so cuddleable, and I just want to like give you a hug with all those nicknames. But we just heard the formal intro. Yeah, we just heard the formal intro, but I don't think I mentioned in the intro, we are now speaking to the reigning, undisputed Rock Tape Summit karaoke champion of the world, back-to-back years, right?
That's a subjective title, I would say, well, but yeah, I strongly
I'm the only voter that counts, and your rendition of whatever it was when you were dancing on top of Courtney Conley was probably the most beautiful thing I've ever watched.
Yeah, it probably was. It was only maybe second to, I would say, me dancing on top of Steve Capobianco in the same way. In the very first summit I was ever at, which is why I feel like I was able to stay in such good standing with the company, because everything was on tape. So I have Steve obviously sexually harassing me, and I can hold that over his head now.
Yeah.
But yeah, no, it was really great. I have a lot of nice, fun stuff planned for this year as well, Reed. So maybe we'll do a follow up after Mexico, a karaoke recap.
There we go. Perfect. So that is kind of a nice little segue to say, like, I work with Joe via Rock Tape. That's how we met. But Joe, tell us a little bit more about yourself. Where are you at? What do you do?
Yeah. So I'm a physical therapist based out of New York City. I have been practicing here for 12 years. So coming up on 12 years. That happened very fast. I have a 7-year-old daughter. Her name is Avery. I am currently engaged to another one of our fellow Rock Tape instructors, who you mentioned I was singing beautifully on top of, which is probably how I was able to captivate her.
Absolutely.
That would be Dr. Courtney Conley.
It's like Birds of Love. You just got to dance and sing to them, right?
100%. Yeah, and she has a beautiful 10-year-old daughter named Addison. So, those are the things that sort of keep me ticking, I think professionally and personally. So, yeah, I always like to just bring those people up in, who matter most in my life, because I think that, just like you and your family, which is just purely beautiful. I just love seeing your pictures and everything as well. That's what kind of keeps me motivated, keeps my drive, and just helps me set my sights on where I'm going rather than kind of staying stuck in the past.
Absolutely. And I think, like, when I speak, whether it's, I just spoke last week to my old high school, and just guest taught a lecture for human anatomy course. And, I'm always like, I'm a human, I'm a husband, I'm a father, and I'm a chiropractor. Like, on
Right.
those three things first, and like that's set in
Right.
order. And I think Kelly Starrett was one of the guys who I picked that up first with, and this is like before I was married, before I had kids, before I had all these other
Yeah.
priorities. But he was mentioning like, hey, this week I had these meetings, I saw these athletes, I did this, and like we cranked out like 10 hours of content, like all this professional business stuff. He goes, that's cool, but I also was able to get to dinner four times, like four times this week.
Yeah.
I went and saw my daughter's volleyball game or whatever it was, or two volleyball games. I was able to go to this practice. I went for a 10-mile bike ride. Like all the other stuff in life that actually matters more in the grand
Right.
scheme of things. So it's good that you bring them up. I love that.
Yeah.
So I was just going to ask you. So PT, 12 years. I know your background, but
Yeah.
let's talk to the listeners here a little bit. Maybe get into like the burnout and kind of a brief version of that, because 12 years is a lot of time to go over in an hour here. But
Yeah.
where
Yeah.
where you started coming out of Sacred Heart, right?
Sacred Heart University. That's correct.
Yep,
Yeah.
Sacred Heart, and then getting into the PT model versus where you're at now. And I'm this is audio, not video, so I'm putting air quotes around the PT model, as in the classic traditional model, inpatient, outpatient PT care versus what you're doing now.
Yeah. Yeah. I think I heard the air quotes though, so I think all the listeners did too.
It's the wind.
I started like most of us, right? Sort of taking a job at the last clinical that offered you a position at a reasonable cost. I think you always kind of end up with visions of grandeur that, regardless of the model you've seen, you can always go in there, change it, and make a difference. And I think for some of us, that is possible. But when you work for a big corporation, it's just a little bit less likely. I started seeing people on average, it was 15 to 18 a day. The metrics that were used for my success was, I love talking about this, visits per referral, which meant however many people would come in as a new patient, I would be a successful PT in this corporation if I saw these people on average 10 times, right? Now, on average, 10 times means that some people would come in five or six, but then a lot of people were coming in 20 or more. That is the metric that always sort of stuck out to me. And then what I would sort of try to get behind as much as I could when I was elevated to assistant manager and clinical manager, because at the end of the day, I was trying to buy into the fact, and I still buy into this fact, that we are into the business of helping people, right? And I think good help, does cost money, and it should require time and effort and consistency and accountability on both ends of the spectrum. But it was really hard not to talk to your staff, or you know even try to think about bettering yourself from a clinical perspective. And it became so much about, how do I keep this person here twice a week for a minimum of 5 to 6 weeks, right? Because if I don't do that, we're also going to run our missing persons report every 2 weeks and be like, well, why didn't this person come back in? Where's this person? Where's that person? And then keep in mind, your schedule didn't get any less busy. So
Right.
even though 10 people fell off, you just met 20 new people that you were trying to keep track of. So that model, I think, was important for me to experience. And I think it is an important aspect for most people to experience, because it taught me the value of time, right? It taught me the value of organizing myself a little bit, of becoming a little bit more efficient with note taking, maybe even becoming a little bit more efficient with examination and treatment, kind of honing in on what was really important. So I don't necessarily want to steer new grads away from sort of quote unquote the traditional PT model, or maybe even the traditional chiropractic model. I'm not sure exactly, now that I think about it, if there are sort of chiropractic mills like there are PT mills that a lot of us physical therapists talk about. I'm sure there are. And, because I think that there's always something to gain from a negative experience. And maybe that's even looking forward to say, okay, I know what I don't want now in my next step, right? And I think that that's really important to take sight of. And that's what led me to my next jump with Perfect Stride. I'm happy to speak their name. They're still a well-established business, well-respected business in the city. I still keep very close in touch with them. And they're fantastic. And they opened up the door for me to be me, give me
Yeah.
the ability to start seeing people out of network for 1 hour. And it was really interesting making that transition from seeing people every 15, 20 minutes to an hour. I initially went in on day one. I was like, geez, how am I going to fill an hour?
Yeah.
What am I going to do with someone for an hour? And then I quickly
And now
realized,
we're begging to have like 3 hours with each patient. Like,
yeah. Now I'm thinking like come January 3rd, I was just having this conversation with a patient this morning. I was like, I think I need to change my initial evals at least to 90 minutes, just to give us a little bit more time on the back end. And even if we don't use it, it's there.
yeah,
Because the one thing I always hate is having to sort of like sell time to
yeah,
someone. And that's what I'm realizing now, with the new direction I've taken now my own clinic in is, selling an hour time to someone is challenging in the sense that now I have a stop time where you have to leave, you
yeah,
know, rather than saying, hey, I'm going to block off, this amount of time. Here's the price. You can stay here for as long as you want with me until all your questions are answered. I don't think that model is sort of taken off yet, at least in the city. And I think maybe it's even harder for me and you to fully commit to, because it is nice to know, hey, this is my hour slot. These are how many people I can see each day. It's organized. I know how much money's coming in at the end of the week. But I'm sort of wrestling right now with the schedule and how to actually give time to newer clients, or that first intake. And I might even sort of keep it open ended. Like, everyone here in the city usually is on a time schedule. Sometimes people don't want to come in for an hour, or can only come in for an hour, right? So if that's the case, hey, I'll block you for an hour. But if someone's like, hey, look, I'm coming in on my day off, um, I'm totally flexible. I might start to offer those people 90 minutes, or even 2 hour sessions.
yeah.
And again, and then sort of scale the price upwards and say, hey, look, this is what we can do. But I think that what I've learned from transitioning to Perfect Stride and then now to here is that idea of forging connection, or a connection with someone, or a therapeutic alliance, like we like to talk
Hmm.
about, happens a lot more than just by physically touching them.
Yeah. I mean, I've never developed a relationship with somebody by just physically touching them, right?
Sure.
Like, the words
Yeah.
have to happen, right? Like, if you just
Right.
physically touch somebody and call it a relationship, that's called assault, brother. Like, you can't, like, to quote Billy Madison, like that doesn't
Yeah.
happen. A
Yeah.
couple of awesome things that I want to hit on there, just to put my 2 cents in, because you know how much I like to
Yeah.
speak,
Please.
right?
I
This
love
is
it.
my show anyways, Joe. Is one, so going back to like the 10 visit average thing, like, I think it's very
Yeah.
true. Our job as healthcare providers, especially in the realm of healthcare that you and I and a lot of the listeners live in, is getting people better, right? If we're doing that, if we just take that as our title job, if we're doing that job, we should be seeing less and less people, not more and more people.
Yeah.
As the
Yeah.
world happens, like, injuries happen, oopsies happen, tweaks happen, performance happens, like, we get to work on those things and we don't run out of patience. But I mean, that's kind of the goal. Sorry. Mail guy's coming in.
Yeah. You're okay.
Thank
Yeah.
you.
You're okay. Well, I think to even just touch on that, I always tell new grads, or when I go to speak at these schools, whenever I have an opportunity to do so, I always say that our job is to put ourselves out of business, right? Like that's a good
Absolutely.
healthcare provider. And then
Absolutely.
by trying to put yourself out of business, you should have more referrals because you're good at what you do. And that was always the metric I thought made more sense to pay attention to. And that's what I would always eventually push my staff to think about. Like, hey, look, I know that the company wants this visits per referral number. What I care about is new patient numbers,
Right.
right? I want to know where new patients are coming from. And are they just finding us on Google? Are they finding us on the spreadsheet from the doctor? Or did they come because 10 people before them had positive experiences?
Right.
And then, those people were telling their friends this was the place to go to. And
Yeah.
really, for the better part of 3 years, at Strength and Motion, which is now the clinic I have here in the city, that's been how I have survived. I
Yeah.
have not marketed to one doctor here in the city since I've gone out on my own. I've done a lot of work in gyms. I've done a lot of free classes, coursework. I try to stay active like we all do on social media, things
Yeah.
like that. But I think
I
that the
think like
biggest
all that,
driver for me, yeah,
yeah, I was just gonna say all that relationship building is where it's at, right? And like a lot of people disagree with that, but that's where it has to start. Now, your Google reviews and how you rank on Google and people look it up and the appearance and all that stuff. I was just talking to somebody. One of my uncles is a marketing guru dude in like weights and scales avenue, so like stuff I don't know about. And he's like,
yeah,
"Well, how are people finding you?" And I'm like, "All right, Paul." Um, I'm like, he goes, "Well, where's your ranking on Google? Like, if I were to look up to you right now, like, where would you be in chiropractor near Excelsior, Minnesota?" I'm like, "I don't know," but that's all secondary. Like, the vehicle is the relationship that I build, or what they hear from somebody who's seen me, or maybe they saw a piece of marketing. But then when they look like chiropractor near me, that resonance with them is, oh, there's so and so down the street, and there's so and so down the street, but I've heard about this Minnesota movement place, and that's like
yeah,
that's the add-on per se. Like the relationship that's established from the get-go is where that plants the seed in their brain, right?
yeah,
um
100%.
One other thing you mentioned on is a while ago here, and not to get too far back into this, but I think this is going to be a nice segue into our communication and how we develop these relationships. Is you said, as a student, you wouldn't push students not to learn all those technical aspects. That's necessary, to pass your boards, to get
Yeah,
that clinical, to yada, yada, yada. But learning what you don't want to do is huge. One of my conscious decisions in my clinical rotations was I'm going to work in this clinic for 6 months, knowing that I don't want to practice this model at all. So that,
right,
or at least that's what my bias was at that moment. I almost wanted to prove my bias correct, right? Being there for 6 months, like I enjoyed it thoroughly, but I learned a lot, not only about what I don't want to do, but how we can transition those pieces of this model to the model that I want to work in. Getting to the clinical side of things, like the technical clinical side of things, it's good to know all your orthos, right? But you were mentioning, skipping to the good part, like the TikTok trend right now. Can we skip to the good part?
yeah.
We're
Then put the
dancing.
hand
Joe and
over
I
the
are
camera,
dancing right now.
and then
You guys
and
can't
then
see
you're
this, but
in Disneyland.
yeah,
That's
we're
that's the
just
ones I've
vibing.
seen.
And now we're in Utah, and yeah. But anyways, skipping to the good part, like my assessment is like, all right, let's see a squat. Let's see you walk. Let's see you get out of this chair. Like, boom, we just
Yeah,
covered like 19 orthos right there, right? Like for lower extremity stuff. Like it's important to know the definition of the orthos and what they actually mean. And if they're positive, it's indicative of this and all that fun stuff. But
yep,
like you can skip to the good part, but that comes with time and repetition and developing a relationship with them. And what I want to get to here, long story short, is asking the question, what do you feel here? So many times I'm working with a patient, I'm like, what do you feel here? They're like, well, nothing hurts. I'm like, great, I don't care about that. Like pain is just a signal, a sensation. Like, do you feel a
right,
twinge? Do you feel a pull? Do you feel engagement? Do you feel anything? Like, does your hair tingle? Do you feel nauseous? Like, do you feel happy?
yeah,
Like
yeah,
any of that, right? So let's skip to the good part and transition into how do you work now at Strength in Motion?
yeah. Well, I think that that is skipping to the good part, and the thing I would start off with by saying is how we were, sort of maybe introducing ourselves. Right, we had a identity, whether it was human, father, son, brother, physical therapist, fiance, stepdad, dad. You know, all of these things sort of meld to make us who we are. And I think that when we are physically and psychologically healthy, we are sort of like the center of our own story. We're the heroes of our own story. We have these very clear roles, when to break them out, who we help by doing so, and what our sort of maybe missions are with each one. When we're not physically or psychologically healthy, let's just say in the presence of pain or injury, most of the clients, and I'm sure that you see the same thing, when I say, tell me about yourself, people immediately become their diagnosis, right? People immediately become their knee pain or their hip pain or their back pain. And I'll sort of let them finish, their introduction about their pain when I'm asking them about them. But then I'll say, thanks for sharing that. But I asked how you were doing, or I asked for you to tell me a little bit about yourself. So could you reframe that and maybe just give me a little bit more of a background on you? And I actually learned that by going to my own therapy through my divorce and battling some mental health stuff on my own. And I remember sitting down at the first therapy session, and I was anxious, and I was, you know, half tears, half, wanted to scream, half, want to just get the hell out of there and just like crawl into a couch and never be seen again. And I just started going on about like all my problems, right? Because we were just sitting there in silence for what to me felt like 15 minutes, but
Yeah.
was probably only 4 seconds. And the 4 seconds was so uncomfortable. I just started blurting out like, I'm depressed about this. I'm really sad. I called you because, I think I'm going through a divorce right now and I'm very confused. And then he just looked at me and said, hold on. I'm Peter. What's your name? And I was like,
Right.
oh, I'm Joe. And he was like,
Joe.
cool. Yeah, Joe, that's wonderful. What makes you you? And then we sort of started the sessions that way. And I took that and I was like, wow, yeah, how many times have I just sort of gone along with the idea that people are their hip pain, their back pain, their this pain, their that pain? And I think what you had just mentioned when you're taking people through their assessments, building from that identity, what are you feeling? I like to use the word cost, right?
Yeah.
So when I'm watching someone, go through a range of motion, or we're doing table tests, or we're doing sit to stand, or we're doing balance, or you're doing a 90-90 or anything, a lot of times, again, people are poor narrators of their experience. They don't like to use the word pain. And that's what I'm sort of finding now, the more I pay attention to people and listen to them. People are like, I don't want to say pain, like almost that's like
Hmm.
a bad word. I
Hmm.
want to say it's discomfort. I want to say it's weakness. I want to say it's tightness. And at the end of the day, I think that is important to acknowledge what word they most identify with. But as we're doing the assessments, I'll always sort of say to them, like you, how did this make you feel side to side? A lot of them, I don't know if I noticed much of a difference. And then I'll just reframe that and say, well, did one come at more of a cost? Like if you and me were going to stay in a certain position, or a certain position on the table, or in a squat, or in a balance, which leg would you want to balance on to carry out our conversation? Which side sit would you want to be in that feels more comfortable or less taxing for your body? And then let's just mark it down, right? It might not be
Yeah.
anything, right? But if we can keep putting things into this sort of like big funnel, well, what sort of drips out consistently from the funnel? We can say, oh, well, your hip internal rotation on the table looks a little bit different one side to the other. You picked side sit on this side was easier. That correlates. Hey, balance or your gait assessment or your running assessment, we keep just coming back to this right hip. I know you said you felt, X pain or Y tightness or this or that, but the consistency of our findings is sort of pointing us in this direction. Does that make sense to you? And I like to say that, and that's probably something I took from our rock tape courses of just kind of continually to reaffirm, and
Yeah.
I think maybe even from Steve, right, and Ethan of, does this make sense? And I probably say that 5 or 6 times minimum with every session, and I'll wait for an answer, and and then sometimes when people are, I feel like they're yesing me along, I'm like, great. Now, how would you speak that back to me, right? Um, because I want to make sure that I'm not overloading. And if I'm
Right.
not overloading them, they're usually able to say, well, yeah, I hear what you're saying about this and this and this and how this piece connects to this piece. If I am overloading them, they'll be like, uh, yeah, well, it has something to do with, and I'm like, all right, yeah, my
Yeah.
bad.
Yep.
Let's back up a little bit, okay? Because I'm going down, I get excited, right? And I'm going down this whole like storytelling arc of, hey, let's make this make sense. But I lost you. What point do we need to come back up with? And then usually they'll say, well, I didn't quite understand on the table, right? And we're like
Yeah.
15 assessments away from that.
Right.
All right,
So you
hold
lost him
on,
from the
my
get
bad.
go.
Yeah, let's go back and revisit that then. And even if we only leave you with a hip internal rotation stretch today, that's cool because we want to create that space here and then have that build. So
Absolutely.
the
No, I asked that question, like, does this make sense? Because like you just said, I get so excited with an assessment because that's where, I mean, that's my care. And I understand, there's a lot better. We've talked about this in the past. Like, I don't think I'm the best treating provider in
Mhm.
even in my town, right? Like I might not have the best, most magical hands, but I feel like I'm really good at assessing the big elephants, the low hanging
Yeah,
fruit, and the
yeah,
little elephants that we can work on for prevention, performance, long term, getting better and more badass, right? And that's what I
yeah.
love, right? I love that arc. Um, And so with that in mind, like I'm always just getting super excited. Like, all right, your hip internal rotation is leading to this, and like I know you came in with left knee pain, but like your right side is actually, like causing or culprit victim situation. We just get like my brain starts going 1,000 miles a minute. And I'm saying all this and saying, does this make sense? Does this make sense? Does this make sense? And occasionally I'll notice people be like, yeah, yeah. I'm like, calm down for a little bit. Like, not to pick on New Yorkers here, but we are talking to the one. Like your motto is like education, empowerment, communications. We are talking to the one New
Yeah.
Yorker who actually has a heart, you guys. But here in Minnesota, we get very passive aggressive, so people don't like telling me no, right? So be like, does that make sense? And you kind of catch that they're losing you. I'm like, don't appease me. Like, if it doesn't make
Yeah.
sense, I'm a big nerd. I want you to be a nerd about this too, because the more you do
Yeah.
out of my office, the more you don't have to come into my office. And yeah, I mean, creating that compliance with that communication is huge.
Yeah. I had this conversation with a health coach in the city, or movement coach in the city yesterday, who's going to probably work with me come January. And she's been dealing with some long-standing hip, knee sort of stuff on the left side. And while we were having our phone consult, I just sort of asked her, "Hey, you've been through a lot of providers. It sounds like you've been through an X-ray or MRI. You've been to, people that I know and respect in the city that I would like, sort of like, double tap on Instagram and things like that." So I sort of asked her, "Well, with all this information you have, what makes the most sense to you as to why you think you're still disconnected from the left side, or not feeling as strong on the left side?" And she was like, yeah, one person, I guess, told me that it was about rotation, and then again went into stories that other people told her. And what I had asked her was if it was accurate. I was like, well, it sounds like, again, you're still filling stories that other people told you, that you don't have a story that makes sense to you. So maybe that's where we need to start. And she said, wow, yeah, I maybe that is the truth. I still don't really know why this is. And I have all this background in this. I went to see this person. They gave me 10 different opinions. And now I started working on 10 different things. And I just feel like I'm still not on a good and narrow path.
Well, and with
And
patients like that, not to interrupt too much, but like
yeah,
with patients like that, like she's been through the rigmarole, right? Like, and let's say we see healthcare providers see this all the time. I've been seeing so and so and so and so and so and so for 3 years. My favorite question to ask is like, how much better do you feel after the last 3 years? Like,
yeah,
they'll say like, I feel better. I'm like, no, give me a percent. 0%, nothing's changed. 100%, you're 21 invincible. Where are you at? And like, if it's 20%, I'm like, more
yeah,
should have happened by then. I might not get you to
right,
100% either. I'm not trying to be like egotistical. I'm just saying,
right,
if it was going to work, it would have worked by now. Like,
right, right. But
yeah.
and even I think to your point, Reed, like, and I'll say the same thing. And I think maybe to just use your example, if you've been stuck on 20% for 2 years, even if you see me or you and we get you to 21%, that's still not 20. That's a positive
Hmm.
change that maybe someone didn't even think was possible. So yeah, I think that for most of us, feeling comfortable with the idea that we won't be with most people from start to finish, right, on their whole entire journey. We're just very small pieces of their journey, or very small interactions. Now, I have a two or three people that come to mind that I've probably been treating or training. I would say we're not treating anymore, but
Hmm.
just training for several years. And they've looked me in the eye several times, and they're like, "Yep, as long as you're in the city, this is my spot. This is where I'm going
Yeah.
to come to for programming and forever." But and then as things pop up, we can detour and blah blah blah. So there will be a couple of people like that, but that's two or three of the 500 people or more I've seen in the last 2 years and or 3 years now. And it's like, well, that's not a great percentage to hang my hat on, that I'm going to be with you forever, right? And I think that that's also too, like, people appreciate. And to go back to the words that we were describing, no one really likes to use this word pain anymore, or it's becoming this maybe negative buzzword, and people are trying to find other words. So when we do identify their word, what I like for them to also tell me is, what is the opposite of that word? So I had a guy come in last week with long-standing low back pain. Has been with a trusted provider I know from Canada. Just moved down to New York City. has sort of been maybe again stuck in like that lock pattern. Like I'm not getting worse, not getting better, but I
Yeah.
moved, I changed jobs, I've been having a hard time with this. And the word that he used to describe his most, you know, uncomfortable sensation was this idea of feeling like closed or tight, right? So words like that are often like easy to sort of, you know, go opposites with. But then that's what we focused on. And he said, yeah, I just want to feel a little bit more open when I'm bending, or I just want to feel like less tight, right? Like I'll even be super happy with that. And now here me and you are like, I gotta eliminate all this tightness. I gotta do this. I gotta do that. Where the guy in front of you is just like, yeah, man, I just want to feel a little bit better and just know that
Right.
I can feel a little bit better, right? And everything that we did with our assessment, I was
AKA
like,
he's
okay,
begging for
does
hope and optimism.
yeah, yeah. I was like, does this make you feel more tight, right? Like, is this bringing you to that negative word? No. Okay, let's put this in maybe just like an opportunity bucket. Like, this is something you could do well and you can
Hmm.
tolerate well, and it's not bringing you into the red zone. How about this next movement or this next test or this next assessment? Oh, that actually makes me feel less tight. So let's put this in maybe a little more of a daily bucket. Maybe this one's good for us to just sort of start to drill each day because it's making you feel less like you are currently. And I
Right.
think having those connecting words for people are really important for them to be able to identify with, because I don't know if you do this or how many people out there are still doing this, maybe just more for insurance purposes, but the idea of pain as a number, I think, needs to be retired. It needs to be hung up because it is the most complicated, potentially emotion or physical, mental experience that we know of as a human being. Oh, and it's also the number four. Like that doesn't make any sense. Okay,
Right.
and I get from a documentation standpoint for insurance, we have to come up with something. Um, but I don't think numbers are it. And
Mhm.
I strongly think that if we even look at the history of the VAS scale, it was more for, can I give you an opioid? Right?
Right.
Like this isn't like something like, you know, like that's been long standing the test of time. It was like, hey, you know, slide your finger along here. If you get to the unhappy face around a seven,
Yeah.
you're going to get an opioid, and that's a jackpot for me as a doctor. And then we sort of just all adapted this. But
Cha-ching, cha-ching,
I think
cha-ching. Yeah.
yeah, but I think it also creates a lot of confusion because you're asking so many different questions, and now you're asking to rate an experience on a 1 to 10. And if you rate any experience on a 1 to 10, even happiness, if you're like, I want to be 10 out of 10 happy all the time, you're not going to be 10 out of 10 happy all the time. It's an unrealistic goal. So 5 out of 10 happiness is probably what's more or less realistic. And you go up to nines and tens, but
Right.
you also go down to ones and zeros. So any emotion on a scale, to have it be all or none, really
Yeah.
doesn't ever pan out for us when we really think about it like that.
I was just gonna say, like, anytime a patient of mine, like, I hate the question, like 0 to 10, 10 being the worst pain imaginable. I
Yeah.
never ask it, right? Because I don't take insurance, I don't have to. But anytime I ask somebody, like, so tell me more about what you're feeling there. Like, if they do say pain, and I give them that free, open space to say, you know, is it tightness, is it engagement, what do you feel? But they do say it's truly pain. It's a sharp, pinchy pain, and they start leading down, like you can see their brain ticking, like it's about a. I'm like, are you gonna say 1 to 10? They're like, yeah. I'm like, all right, well, here's my stitch on that. Like, rate your happiness right now, 0 to 10. And they're like,
Yeah.
I'm like, I don't. I mean, I care about your happiness, but like, I don't care about the number, right? Like, I can feel that.
Dude,
I
you're
can
from
see that.
Minnesota. You care about the happiness.
I'm like the most aggressive Minnesotan I know. I think I've been spending too much time hanging out with people like you, Joe.
Yeah.
Um,
Yeah.
but hey, wait, wait,
Yeah.
wait. I forgot to ask you, are you wearing pants?
I am.
You found a pair of pants that fit your large VMOs?
Oh, geez, it's been a struggle. Ask Courtney. Every time I
No,
put on a
that's
pair of pants or shorts, she puts her head down and just starts
I
shaking her head.
I shot Courtney a text. I'm like, you got any juicy bits I should drop on Joe right now? She's like asking about his VMOs. I was like, all right. So and I just remembered that right now. But um I like that. So let's switch up gears a little bit, going from the clinical side of things to more the education side of things. And of course,
Sure.
you educate your patients like we've been talking about, but specifically you've been working on a bunch of different projects, new ones as recent than compared to late, but you've got top down, bottom up in the bucket. You've got
Yep.
this listening to pain we were just talking about off air here a little while ago. Um, what else do you have going on with continuing education besides those two?
Yeah, so I think the next sort of biggest thing on the horizon, well, it's not really on the horizon.
It's happening.
It's already here. Would be sort of the work that I'm currently doing with Fringe, which is currently right now our whole person health and wellness company that we launched in June of 2021. So I took on a role there as sort of lead educator. So sort of what I actually rebranded myself as is Chief Storytelling Officer. So I'm CSO of Fringe.
I like
And
that.
I think that it sort of allows me to bring in a lot of the things that I'm passionate about or that I've learned over the last 12 years of being a human, being a dad, being a PT, and sort of mixing it into really the whole global world of healthcare. So we launched in June of 2021 with a list of factors that we totally believe are maybe not broadcast enough or viewed as alternative medicine. And we'll get into that in a second. But among the list would be things like, not totally uncommon. Movement is medicine, touch is medicine, nature is medicine, breath is medicine. And then maybe one that was a little bit more out of the box, or at least the one that we chose to start with, was the idea of plants being medicine. We chose to focus in on the cannabis plant, mainly CBD as it stands right now, and how that may impact a person's health. And we are slowly building out our story into breath, into movement, into meditation, into the art of communication and storytelling, and how all of these different things carried us from a people or from a healthcare standpoint for thousands of years. And now, don't get me wrong, a lot of things have since been replaced, and rightfully so. So when we use the term alternative healthcare, the reason alternative healthcare emerged was because there was something better that we can do for the illness you were experiencing. So this is why me and you, when we go to the doctors don't put leeches on us anymore. They actually prescribe us either antibacterials or antivirals or antibiotics, something along those lines. Because when we compared your leech treatment to antibiotics seem to be fixing a lot more people, or at least not resulting in death. So,
Right.
alternatively, we have a better solution for you. Praise be to science, right?
Right.
I think what's ended up happening, and I don't think it's happened by anyone's fault, but as technology has really just went on this straight vertical line over the last maybe 20 to 30 years or so, where things continually evolve and even become outdated every 2 to 5 years now, where it's like, wow, well, you still have an iPhone 10, loser. Like, how do you even have an iPhone? How does that thing even work?
I've
Right?
got an
And I was
iPhone
like,
8, so
yeah, I
don't
was
pick
like,
on me.
yeah, oh my God, like, what satellite are you still using? Right? Like, but like
Do you hear
five
do you
years
hear the
ago,
dial-up tone when you call people?
yeah, yeah. But 5 years ago, that was the peak of what Apple had to offer, right?
Mhm.
And now every year something new is coming out. And I think that with the inundation of information on social media, particularly these before and after posts and how people feel better after doing an isometric, or people feel better after this, and then healthcare practitioners feel the urge to be like, whoa, look at what we did with one session. This is not realistic messaging that we should be portraying to people. Yes, I think we should be portraying the idea of hope, that there are easy things that you can do to sort of control your health and well-being. But from an alternative standpoint, is the pills that we're now currently involved in, let's shadow or put a light on opioids, have those been better than exercise and touch and movement or breath work to sort of deal with anxiety and pain and everything else? Has any of the antidepressants that we're put on, again, when you go to like look at toe to toe with just even something like CBD or meditation or yoga, like is that alternatively fixing more people with mental health disorders? And I think from the trends I've looked at is no. So the framework that we've sort of evolved with Fringe is that these list of factors that we have that really think that we attribute to people's health and well-being and that have attributed to health and well-being for a long period of time shouldn't be viewed as alternative healthcare. They should be viewed as original healthcare. And whenever we're thinking of something new, we want to compare it to what we were doing originally. How were we able to survive for, you know, 50,000 plus years, as our, current Homo sapien model maybe suggests, and overrun the planet, right? And become the dominant species, right? And how were we able to, pass down culture and tradition? And it was with all of these different things of community and family and storytelling and rituals and spiritual aspects of things that people seem to just push away because they're so uncomfortable, or I don't have a clean exercise to prescribe for your depression, right?
Right.
And this was another conversation I had with a patient yesterday when I asked her, well, how else has your pain affected you in other ways? And she said, yeah, it's kind of depressing. And I was like, okay, tell me what depressing is to you. And she gave me a perfect list. It was all social aspects. I can't be a good wife to my husband. I can't go out and play tennis with my friends. And it was something along the lines of, she was a principal at a school. I feel like I can't take care of the kids at my school. And that's really sort of like depression, right? It's this idea, this inability for you to connect outwardly within
Hmm.
your environment or the people who matter to you most, right? The way that I understand it. And that sort of keeps you locked in the past, almost like in a regrettable sort of way.
Yeah.
So I can't give you 3 sets of 10 of kettlebell swings and think that your depression's going to get better, and if we look at the antidepressant sort of stats, I believe that they only help about 20% of the people who take them actually have a shift in their depressive states. And even then, the shift is very mild. It's very much like pain medication. So we're throwing out all these alternative ideas that don't seem to be better than the idea of telling someone they just need to be a better human. And I
Right.
think that's where our story is going to really sort of evolve at Fringe. We're entered into the space with plants and CBD to offer people a product that they can start to habit stack with. And the interesting thing about sort of reading more about cannabis, which I knew nothing about, and the CBD plant, is we don't know a lot about it yet because there's still so much red tape around trying to research it and study it. So where a lot of studies are stuck in preclinical sort of trials or loops, a lot of the people who are pro cannabis don't really do great studies. A lot of people who are against cannabis do even worse studies. So
Right.
you're sort of, picking off the pile here of non-great things and then trying to make connections. And I think that's why, for the most part, we see so much variability in people's responses. Where I think that we're coming to settle down now is for people with an overactive endocannabinoid system, these products can make a big difference in your anxiety, in your circadian rhythms. We were just talking about your
Hmm.
rhythms off air before the show. And then maybe even potentially in inflammatory responses that lead to pain. But if you sort of have a normal tone of your endocannabinoid system, well, you might take something and not really feel much different. If you have a low sort of tone, you might take something and then really again not feel much different. So we're having a hard time trying to classify who would benefit the most because it's really hard to measure circulating endocannabinoids in
Yeah.
your body because they change so much, even moment to moment or hour to hour.
Well, I mean, we're talking like biochemistry here, right? So like
Oh
not to
yeah,
get too
which is
far into
also
the weeds, but like I
yep.
equate, right, and I know even less than you probably did when you started entering into the fringe world, right? Fringe company world that is aptly named Fringe. Um, but I hearken it to vitamin D, right? Can we overdose
Yeah.
on vitamin D? Maybe, right? Like at very, very high levels, but I could take 50,000 IU today and be like, all right, like I'm not
Right.
gonna get syphilis or something, or scurvy is what I was thinking of, not syphilis. Scurvy from
Yeah,
vitamin
yeah,
D or
yeah.
vitamin C. But yeah, anyways, so like, or syphilis for that matter, it doesn't matter. But
Yeah,
um,
whatever.
the endocannabinoid system kind of works the same way. Where if I take CBD and I'm very, very low tone, it might not do anything. It might not help me in that realm, but it's also not going to hurt me. And that's what I think is interesting about plants, whether we're talking CBD or whether we're talking kale for all it matters, is like if your body doesn't need it, well, we have this excretion system that works great, and I get to poop once a day or pee a couple times a day. Like
Yep.
it just puts it out. Like, and that's the difference between plants versus pills. Is if you alter the chemical makeup of what our body wants and tolerates with pills instead, your body can't really excrete that well. It actually stays in your system, tries to recirculate. Liver breaks it down. We get liver damage sometimes if we have too much of it, Tylenol and stuff like that. Um, but plants are different. Food is different, right? Meditation,
Right.
breathing. Like you can't overdose on breathing. I mean, you
Right.
theoretically could pass out if you breathe the wrong way too many times, but yeah, like it doesn't work that way, right? And I think that's what's interesting. And what you were saying of, dare I use the word, more primal healthcare of social communicate or social connection, right? Breath work, meditation, nature, walking, movement, the things that carried us for arguably 50,000, 30,000 years, whatever camp you want to believe in there. Um, it's a slippery slope because oftentimes, like, primal isn't the answer. I don't think I should be a carnivore, right? Um, Now that we're talking plants, that doesn't make any sense. But I mean, there's certain things where it's like, yeah, should I be out like killing a elk and then eating its testicles to get more testosterone? No, I mean, like, have I done it? I'm not going to answer that. But like,
Yeah.
I,
Different
there's
podcast.
certain things. There's certain things where it's like you can go too far. Do you feel like that's a fine line to walk with the realm that you guys are getting into right now?
Well, I think it's a fine line to walk when you add THC into the mix, right? So CBD and THC are the two biggest components of the cannabis plant. THC is what sort of gives people the sort of high of the or the feeling of being high from ingesting too much. CBD is a non-psychoactive component. So you brought up a couple interesting things there that I'd like to touch on. The other reason why it's sort of hard to regulate the CBD space, on top of it sort of having a lot of red tape already, is that it's listed as a supplement. And this is done on purpose to sort of, again, skate under FDA regulations because in our country of the United States, the FDA does not regulate supplements. So there's certain things that you can say about a supplement, and then there's certain things that you can't say about a supplement because it sort of borders on the line of being quote unquote medicine. To have something be listed as a medicine, it usually takes millions, if not more, dollars of research, countless human trials, and then again, when we look at the efficacy of a lot of these pain medications that go through all these rigors and standards, again, they're not yielding a lot of tremendous impact, or maybe not as much impact as we're led to believe they are, right? So, what was sort of the thing that brought us to our list of factors that we think promote overall health and well-being? It was the things that was connected culture to culture, region to region, continent to continent, without these people interacting with each other. So when we go back and look at the cannabis plant, we'll just focus there. It doesn't really matter what region of the world, unless we're in sort of Alaska or
Say
sort of where things don't
Antarctica
really
or yeah,
grow.
yeah,
Yeah, things don't really grow that well. In every region of the world, cannabis was a part of culture, whether it be religious purposes, whether it be healing purposes, or even just recreational purposes. So every single peoples before us found value in this plant for different aspects of health and well-being. Now, like all good Westerners, we like to overindulge. Like all good Westerners of the past, we like to tell stories and sort of relay propaganda about different things. But the whole reason why cannabis has gotten a really bad stigma after being, quote unquote, legal for thousands and thousands of years was because of very, very much so a lot of the racially driven propaganda of the 20s and 30s and 40s. And connecting the cannabis plant with the African American community and the Mexican immigrant community, and sort of, well, oh, if you smoke cannabis or you use cannabis, it's going to promote interracial relationships. And back then, ooh, oh my
right.
goodness, there's nothing worse than an interracial relationship. We should stay away from this stuff. Oh, it's going to fry your brain. It's going to melt your brain. And the stories shifted without evidence And then as multiple, sort of different presidents were sort of tasked with the idea of forming task
The war
forces
on
and
drugs and yeah.
and the war on drugs, trying to validate the war on cannabis has time and time again fallen flat.
Yeah.
And there's a few good reports out there, one done by the LaGuardia Committee that has been submitted to multiple presidencies and has been revisited by multiple presidencies. And each time it's revisited, it's sort of, well, we really don't have any reason why the cannabis plant is listed as a Schedule 1 drug and crack cocaine is listed as a Schedule 2 drug. So if
Right.
you and me were going to do studies, it'd actually be better for us to do studies on crack than it
Right.
would be on THC right now. There's less red tape. So that again doesn't make a lot of sense. A lot of it was staging by the war on drugs. It was a low hanging fruit. You brought that up from before, and it was just easy to sort of manipulate, right? And then we can go into sort of deeper layers there, but this is not a political show. But it's very interesting on
No,
how
come on, let's talk
the whole
politics. Like,
well, but the whole idea of like bringing it back to what we were talking about in the beginning with the way I run my practice, or I think about storytelling and communication is so valuable. It's the same thing that we've now done with everything else that we used to originally believe in.
mhm.
So people will come in to ask me all the time. Well, I don't really like this breathing stuff. I'm like, what the hell are you talking about? You don't like the breathing stuff? That makes no sense to me. It's breathing. If you don't do it and you don't do it well, how do you expect to survive? And how do you expect your body to thrive? Like, you ever put a plant in a closet? Without sunlight, the plant dies. It doesn't matter how
Right.
much you water it. And then the same thing, if you just give it sunlight and you don't give it water, it's going to die. So you need to be able to control your breath to balance everything. You need to be able to have a family or friends or someone close that you can trust as a social network. We lived outside for a reason, for a long time, and we
Yeah.
lived in specific climates for a long time. We don't go outside anymore because we built these prisons and houses and
Yeah, we live at
workplaces that
72 degrees constantly and yeah.
exactly. So there's no we went from having a lot of variability causing a lot of adaptation, and specific ways of doing that, to trying to find the perfect set point. And I think that, to sort of like then bring all this back together too, even from a cultural standpoint, that's the biggest difference as it stands to me right now between East and West. West is telling stories about parts being out of balance and at war with each other. And if we fix the parts, everything is going to be fine. Whereas now you look at East and more holistic approaches, and people might even look at these fringe factors and be like, oh, this is all like holistic, hippie nonsense.
Yeah.
But the idea of an Eastern storytelling from a medicine standpoint is that, hey, look, what we're trying to search for is harmony. And that means that you potentially live in a state of pain, but you continue to be who you are. There might not be an answer, but what are we to learn from this?
Right.
And it's a lot more open ended, and a lot more people are finding satisfaction with the idea that, okay, I don't have a weak glute muscle. It's not my one glute need. It's not my, poor external oblique function. It's not my, posterior medial striatum not expanding enough. It's everything, because I'm a person, but I'm also a person that's plastic. So all of these things I should be able to adapt to. One weak muscle, one limited joint, right? I should be able to cope with this. But because I think of, again, all this information that's out there and what's right and what's wrong,
Yeah.
oh, people have come in to see me and not even have goals. Just be like, well, I saw on Instagram that like you weren't supposed to do this, or if you lack hip
Right.
extension, you should get it trained. I'm like, well, so what? You just want more range of motion to just have more range of motion somewhere? And they're
So
like,
you want me to
yeah,
delete
can you
all
help me?
your red checks
Yeah,
and put more green
yeah,
checks next
yeah,
to it? Like, oh,
yeah.
okay, give me a
That's what.
highlighter.
Yeah, and I think that the reason why I'm so excited to work with Fringe is because I think that, again, as we explore these ideas of community, as I explore these ideas of breath, as I explore these ideas of maybe even plants being something that heals us, time and time again, the things that I've read and the books that I've read and research that I've read are coming back to, these are the things that are keeping us alive on the planet longer,
Mhm.
right? I don't care if you have the world's strongest glute med. That's not going to increase your life expectancy. Like,
Yeah.
what's going to increase your life expectancy, hands down, time and time again, social relationships.
Yep.
And trying to hone in on that now with people in physical therapy has been a challenge for me and sort of unexpected for the patients that walk in. Because if you're depressed and not dancing, well, how else can you connect with your husband at home? Do you like board games? Do you like to go on a walk? So instead of dancing, can you program 6 p.m. as a 15-minute walk, which is you and your husband, right?
It's
Can you
the
call
habit
your
loop,
friend?
right?
Yeah, yeah, exactly. Call your friend and invite them out for coffee. You know, go out for a cocktail when you can. I mean, again, like I'm not saying to go out and drink and drive. I'm saying like go out
Right.
and try to find the things that make you feel like you again.
Yeah.
Because
Fill your
again,
cup.
all my exercises, yeah, if you want a stronger glute med, I can get that for you. It's going to take 6 to 8 weeks like everybody else. And I can give you a tighter band. I can give you a longer hold. I can add more weight to the bar. This will all be progressive adaptation that I don't know or don't think is going to keep you alive or happier on the planet any
Right.
longer. What has been shown to make you happier or more life satisfaction is meditation, is this idea of combining or stacking different elements of relationship, community, nature, plants, touch, movement, like, and having these things funnel and build off of each other.
Yeah. No, I think that's great. And like something I'm pulling up right now is so patient questionnaires, right? Like the initial patient intake. On the back of mine, I've got, and this is always like when people are filling them out sitting in my office, they're like, okay, like they give like a little hesitation breath kind of thing, but my goals, right? So like it's got have
Oh,
you
yeah.
seen previous care? Are you pregnant? Please listen to current medications, like all the typical patient intake stuff. But I've got a whole
Yep.
page separated just for goals. How would you rate your overall health? 0 to 10, right? And like this is the only time I use 0 to 10. How would you rate your
Mhm.
current state of nutrition? How would you rate your current activity level? How would you rate your overall mental health? And this is where I want to get to, because the next two questions, like the first four questions that are like, I care about, right? Especially if it's low, but usually people put higher or something like that.
Right.
But I
Yeah.
definitely peek at it, right? But then after that mental health one, it's do you think your pain or issue is limiting you from performing daily or athletic tasks? Yes or no, right? If that's yes, well, let's talk about what those tasks are and see how we can get
Right.
you almost scaled to getting back to those tasks to help the problem, to lean into that tolerance issue that might be happening with your glute med, for example. Next question is, does the thought of your pain or problem cause any worry or anxiety? And so many times people are like, yes, absolutely. Like
Yeah.
there's a huge open door. Walk right through it and talk to the patient about that, right? Like if they answer yes to those last two questions, like you have to have that conversation. And I think
Right.
that's something that a lot of people are missing, and not only on the conversation side of things, but how to treat it per se, and
Right.
give advice for it.
Right. And 100%. And that's the thing. Like, we at Fringe don't want to be labeled as a CBD company, right? We
Right.
want to be more than that. However, but because you said, like, we know CBD has a tremendous health and safety profile. We know it's not going to harm you. We know we can play with the dose. We know we can play with how it's delivered. We decided to go with water soluble because it's easier for you to digest and absorb. You don't need to hold oil in your mouth for a minute. You don't need to eat it with a meal. So you can take it when you need it the most. And just again, having that idea, and this is why I'm also a huge fan of placebo that we can probably talk about on another show. I'm telling my body I'm taking a substance that's going to
Mhm.
calm my anxiety, right? I'm now going to pair that with breath work or meditation for 2 or 3 minutes, right? That's it. And then eventually, what I want you to be able to do is after you've taken CBD for 30 days or a couple months or whatever, and you don't feel like you need that component anymore because now I know how to actively cope. But that was my first habit stacking moment to sort of know I'm taking control of my health. I think that's huge. And there's a lot of studies on CBD where people's pain doesn't get better. But what's interesting is the follow-up questions like you asked. This is why I think questions are so important. People rated their quality of life better. So
Right.
it's not about fighting the pain. We are not at war with pain, people. Like the same thing that the war of drugs doesn't exist, the war on pain doesn't exist. And we need to
Yeah.
get this out more, that you don't need to be out of pain to live a very happy, successful, and productive life.
Yeah. And so I raised my hand here. I know this is audio, but Joe saw the finger wag here. You said placebo. I hate that word, but I love placebo. If we
Mhm.
change the word or the the same definition, right? We can use the exact same definition of placebo, but change the word to perception. Because what you just described there is more of a perception of what they anticipate feeling or should feel, right? Think about feeling versus an actual placebo. And we
Right.
see this all the time. Like you were mentioning, the research on cannabis and CBD and THC is so hard and biased for those who are pro versus con and things like that. But in research, there's so many times where they can't provide a sham study. We see this with
Right.
our rock tape cupping, for example.
Hmm.
How do I
Hmm.
put a cup on somebody and then put my headphones on somebody else and say, this is a cup? Like,
Yeah.
it's not, it doesn't work like that. Like you can't sham a lot of things. You can't get a placebo to truly take hold. So rather the idea of perception, and perception, as we all know, can become reality. It's,
Right.
if you believe it to be
Well, it
true, it's
is.
going to be
That
true.
is
I
right. That
think,
is
therefore
your
I am.
reality.
Yeah.
Yeah.
Yep.
And that's the whole thing is that, but, and then, to keep connecting dots, like when people come in and their perception is they are their pain,
Yeah.
to shift that and to give them this idea that, hey, your pain at this point, I love to use this term around pain. It's a learned signal. I'm sorry, it's a learned noise, not a worthwhile signal. So it started off as a signal. Hey, you went too hard and too much at the gym. You slipped and fell on ice.
You stubbed your toe.
Had some sort of you had some sort of injury. So we're grateful for acute pain because it can protect us and teach us and then keep us safe in our environments. The chronic pain window that I've started to describe to people is anything between 2 weeks and maybe 3 months, where your body, again, depending on what's happened to you, still might be recovering, right? I've sprained an ankle, for instance, right? So I know the acute phase is done. I'm no longer sort of in this inversion moment. My tissues are unstrained, but I still have this weird pain when I'm stepping, and it's just persisting. Once we get past this 3 month mark, or maybe I guess 6 week mark, according to more research, I think that the beneficial component of the pain, like, hey, teaching me, hey, Joe, don't run too much too soon. Don't do this too much too soon. Hey, remember to work on this and this. It becomes a lot less meaningful because I already know this.
Yeah.
So the learned loop is now anticipation. It's perception. It's me now connecting, walking to my ankle pain.
Which
And then
leads to
it's me also
avoidance.
now, right. Now it's me also connecting steps. And if I connect that, that means that I'm not connecting with my partner. That means maybe I can't do laundry in my house. That means I can't do this. And now all these tags of completely meaningless words and random information are reinforcing the painful signal. So
Mm-hmm.
we've all seen that now, maybe on, I love watching like neurons connect on Instagram on all these like neuroscience pages and stuff like that. Well, when those connections happen, what we have to realize is that's one connection of a billion other ones when we fan
It just
out. But
avoided all these
as,
other ones.
yeah, but then as that one neuron connects with that one, and now another one connects with another one, the one that we saw connect in the Instagram post is now being shielded by a lot of other information. It's actually becoming encapsulated.
Yeah.
So the messaging from all of these other random events now can trigger the response or the activation of that sequence. And that's really hard for patients to understand and sort of like try to cope with that.
Mm-hmm.
Wow, just, seeing a color, interacting with my boss, being with my spouse, cooking can cause my pain, even though I'm not in a state of distress or potential harm.
Yeah.
And to sort of, again, shift people's perspectives, like you said, on that, or the perception of like, hey, look, you're in your house right now. You're with me. Do you really think you're in danger? No. Well, okay, then there's nothing to be afraid of. So maybe afraid is a bad word, or fear is a bad word to
Threat.
associate with your pain. So we have to break that, because, even threat, right? Like if I was fearful of something, the best option for me would be to remove myself from that situation, to run away from it, right? If you came at me with a knife in
fear
Mexico,
avoidance patterns. Yeah.
I would be,
Hey,
I would be fearful, and
I
I'd run
might come
away
at you
from
with a
you.
knife in Mexico.
You might, but I would, yeah, totally, and I avoid you. So that idea of like people being fearful, and I'm like, well, okay, so you really think that if you do a squat, your knee might explode? Sometimes people say yes, then yeah, then that fear is an appropriate word. But to your questionnaire standpoint, anxiety and fear are two very different things,
Mm-hmm.
right? Depression and being sad are two very different things. But when we don't have that emotional intelligence or that psychological health, we group all those things together. So they'll cause very similar distressful feelings. And then we'll try to solve those feelings, right, with the same response, right? So removing myself. But if you remove yourself and have anxiety, it's only going to make your anxiety worse, because now you're not confronting anything, and now you're just leaving more things to chance,
Right.
right?
Right.
If you're sad, oh, that's fine. You can still probably go for a cup of coffee or go to a party and just put on a happy face. But if
Right.
you're depressed, you're probably not going to be able to do that, or not want to do that, and then make yourself feel more depressed for not being able to do that.
Yep.
So
Vicious
what
cycle.
happens there?
Yeah.
It is. It
Well, I
really
think
is. But I
a
think that's
big
why it's
part of
such an
that
important part there.
is being like I tell my kids this all the time, or however much they understand, but like it's okay to be bored, right? And on that
Oh
same
yeah,
vein, it's okay to be vulnerable and be left with your own thoughts, and then explore those thoughts. And like, so I've had my own mental health issues in the past, and then like most recently, 3 months ago, head trauma. So I had post concussive syndrome stuff going on, and this is like my ninth major concussion kind of thing. It's like post concussion, I thought I was having a stroke, and like start becoming like a little bit into myself, and like not depressed necessarily, but highly anxious, right? I couldn't fall asleep at night, and that was a trigger. I would stay up for days on end because I thought I was going to die while I slept, because I thought I was going to have a stroke. I had
yeah,
zero
sure,
stroke symptoms, right? Like it was just a thing in my head. And so, like, the guy that I was talking about, is like, well, your questions are the answers, right? Like, the fact that you have a question is a fantastic thing. The fact that you are exploring your vulnerability with this mental health lapse, per se, is a fantastic thing. So what did we do? We went out in the middle of, I don't know, I think it was like 22 degrees, and just walked around in the woods and just chatted and breathed, and like, wow, nature and breath, and like, and a little bit of conversation about it. But like, yeah, I mean, all of a sudden, just boom, next day, I'm like, questions are the answers. Like, I have a
yeah,
question about this. Like, what do I think about it? Let's be left to my own thoughts, be vulnerable, understand it, not avoid it, lean into it, be more tolerant, be more resilient, and just make it happen, right? And I think that's
yeah,
huge. And I know
yeah.
you've had,
And that's the thing. Yeah.
I was just gonna say, I know
Well,
that
that was going to
you've
say.
gone through that loop too, and like in a similar different light. You know, like everybody's story is different, right? And it's I mean, depression's a bitch. So
Yeah, 100%. And that's your cocktail, right? That like for you, being out in nature made sense, right? Connecting with someone, having a conversation. And that's exactly why we came up with this list of factors. It's not because you need to do every single one. These are the ones that, when we look at the test of time, have stood up culture to culture. This is what our ancestors resorted to in their times of need. And right now, we don't have a lot of things doing much better than what we used to do, right?
right,
So we came up with this tagline of, well, it's your life, it's your lab. So as long as you know you're taking things that are not harmful, like a CBD, and eventually what's going to end up happening is more and more states become recreationally legal again with cannabis, we're going to be able to study it more and then say, hey, you know what? Now we've been able to run high quality studies on human beings in all 50 states, and maybe even other places. And then this is a 2 milligram ratio of THC to a 10 milligram ratio to CBD. This seems to be the best entry point to help people with anxiety,
yeah,
not to leave them high as a kite, but to
right,
actually have them be functional. And to sort of iterate on that plants idea of the growth of plants being medicine. I just look at Bessel van der Kolk's work. He's the author of The Body Keeps the Score. Has a lot of courses on PESI. They work very closely together, and he has a lot of videos in his courses about psilocybin treatments
yeah,
or LSD treatments, right? And helping people with trauma and anxiety and childhood issues. And again, not the idea of you're trying to overdose people on psilocybin or LSD, but you're trying to find a ratio that we have used traditionally in the past that's going to help people make new connections in their minds. And I think that's really the most exciting stuff of this plant-based medicine idea, is it unlocking sort of conscious experience for us that
hmm,
these neurons are going to sprout and grow and make these connections, and then we'll know, like you said, that that's possible. I can feel a different way. I can shift back to that state. So I might need 2 or 3 sessions of cannabis, of psilocybin, of walking in nature, of
hmm,
breath work, of this, of that. and then I can now remove the psilocybin, LSD, or whatever other plant-based medicine maybe comes up, and
Without
then instead I can
withdrawals
say,
and yeah.
right. Now I know, hey, I've experimented. I know when I feel down, I call up my friend. We go for a walk in the woods, regardless of how cold it is, and then I'm reset, right?
Yeah.
And now you have that active coping strategy. But again, too many of us are just staying, I think, again, with this loop of, well, people are using THC or psilocybin or LSD. And again, look, everyone abuses everything. You can abuse Tylenol, you can
Right.
abuse water, right? Like you can abuse every single substance on the planet if you want to. You just said I could take 50,000 IUs of vitamin D, right? You can abuse everything.
Yeah.
So yes, there are always going to be outliers who take what we want to do too far, but we can't let that be what we all focus on.
Right.
And we have to end up, like, again, learning to deal with that. That, yeah, hey, look, those great exercises and those communication notes that I gave you, your next patient might punch you in the face, and you'll be like,
Right.
well, thanks a lot, Joe, for making me ask that question.
Right.
But you could potentially help the next 100 by asking it. So we'll remember the one that punched us in the face and not
Right.
want to ask it again or not want to do that treatment again. But again, for the greater good, we need to keep going back to it and staying consistent and trying to learn more and more.
Well, and I think, I mean, the biggest thing that I love about every guest, and especially you, just knowing you for the last 3-4 years now, hell, even longer than that, I think,
Yeah, I think longer. Yeah.
is being inquisitive, right? And like always being a curious mind. And I think that's the people that anybody in any profession, any social network area, you gravitate towards inquisitive people. Maybe you're like-minded, maybe you're not, but somebody who likes asking the difficult questions, right? And I think that's a big gap in our world right now, is asking the difficult questions and feeding into, again, aptly named, the fringe aspect of things. But we got to stay on schedule here, so we gotta get rolling here. We ask 3 questions to every podcast guest on here. I did not give you a heads up to these,
No,
so
you did not.
these answers, I've just decided flat out, like anybody I ask if they want a heads up or not, most people say no, because that's
Yeah.
inquisitive, curious-minded people. So I'm just gonna give it to everybody random. Try to make these answers, if they have to be professional, be my guest, right? But make them as knee-jerk reaction, anything in the
If
world.
they
Doesn't have to
have to
be
be.
doesn't have to be related to you being an awesome PT and a badass dad and a good
Oh man, I
fiance
appreciate
and having the largest VMOs in the world. Okay. Um,
that.
if you could be ranked top 10 in the world at something, what would it be and why?
Oh wow, that's a great question. I would say first gut reaction, just because I work on it so much, would just be listening and asking more questions, because I've failed to do that previously, and it had tremendous impacts on my personal and professional life, which is why I think I'm so passionate about trying to teach others to learn from that mistake.
Yeah, I think that's huge. I resonate with that very well, as you know. Like I get socially awkward and I end up talking instead of listening, right? And that clinically, relationships, friends, family, everything, I just blurt instead of sit back and listen. And which is why when I'm speaking, teaching for Rock Tape or speaking to a conference or something like that, or even clinically, if I ever get the chance to watch myself, I hate it. Like I never listen
Yeah.
back to any of these
Oh, me
podcasts
too. Me
because
too.
I hear myself interrupt and talk instead of listen and gather. And it's a huge component that a lot of people should work on. But
Yeah.
I don't know how you'd rank to be top 10 in that, but
I don't
that
either. I don't either.
that might lead us into this next question, which is what's one thing you know you can do better at and aspire to learn in the next year? Can't be the same
Oh,
answer now.
yeah, no, yeah, for sure. I mean, how could I become a better listener, Reed? Anyway, one thing I aspire to learn in the next year, it's actually probably more business related. I feel that I have put a lot of work into my personal relationships over the last couple of years. I feel like I've put a lot of work into this idea of finding a passion or a passion word to sort of build a lot of the things with my practice. But I feel like I've neglected a large part of how to be a better business person, how to actually reach more people now, because I have worked on the other two aspects. So I think for me, it's becoming a more social person that's connecting more. Like, you know, you do a wonderful job on these. We've had conversations before, and I've had on my list to, you know, start a podcast just so I can talk and meet more people, reach
Yeah.
more people. I've had on you know, we talked about marketing to clinics a little bit before too. Like, I've had on my list to like talk to a business coach, and these are just things that I've just kept on the list. And I look at it, I'm like, oh, hi list. Okay, I'm not going to
Right.
do you today. I'm not going to do this today because I'm going to substitute with anything else that makes me feel more comfortable.
Right.
And I think that sort of, again, to some degree, is a little hypocritical because I try to get people to think of being comfortable with being uncomfortable.
Hmm.
And I think it's time for me in the next year to be a little bit more uncomfortable with the growth of the clinic and you know, push the boundaries a little bit more.
Yeah, and I think that's a hard thing for a lot of clinic owners. Like, I am not a good marketer and
Yeah,
in the grand scheme of things, right? But I love building relationships, and that's one thing. You know, I was
right.
talking to another guest on the podcast about this. Like, the classic model of building a business in any service avenue is not how I personally function in my enneagram type and things like that. So once I got rid of that and said, like, okay, I don't need to go door to door and knock and meet, you know, shake 1,000 hands a month. Like, that's not me. But if I just so happen to meet somebody, I'm going to do really well with that one person, genuinely building that one relationship versus that. And like, that was a big paradigm shift for me. So I think that's a big thing. And the growth of your business has been a blast to watch. You guys, or you currently, but you're talking about bringing on some more team
Yeah.
members. It's been a really fun thing to watch from afar. So,
Thank you, brother.
what's one actionable step that you would advocate for listeners to take better care of their relationships, their health, their movement, or their lives? So, one thing they could do once a day, every day, kind of a New Year's resolution sort of thing, or once a month.
All right. I'll also take it different. Breathe through your nose more.
Yep.
That's it.
Yeah, man.
Because I didn't want to say I didn't want to say listen. I didn't want to say ask questions. I strongly believe in those too. But what I've just been trying to tell my patients is to be more aware of their breath, breathe through their nose whenever possible, and slow yourself down. That's it.
Yeah. No, I think that's huge, and it's funny because regardless of backgrounds, I think you're probably the third or fourth guest that said something along those lines. Um, Lately at night, you know, it's dry here in Minnesota, and I've done this a lot in the past, but I'm never a every night kind of person. But the last 4 or 5 nights I've been, or 4 or 5 days ago, I was waking up with like a little stuffy nose, little cough in the throat kind of thing. So I'm like, I've been mouth breathing all night. What do?
Yeah.
Tape the mouth shut, right? Like, if you're sitting there for 7, 8, 9 hours or 4 hours like me, like 4 hours of nasal breathing subconsciously, that's huge. And it slows you down. And if you're looking at uh, HRV or my heart rate dip and all that stuff, it all got improved in the last 4 or 5 nights of just taping my mouth shut. And it's huge.
Yeah.
So
Yeah. It's very
um,
powerful.
it is. It is. The nervous system, it's a wild, awesome place, right? Well, it's been great having you, brother. We'll actually see you in a couple days here.
Yeah. Yeah.
Um,
Yeah. It's exciting. Yeah. Not next Friday, the Friday after. The next Thursday after. Yeah. That'll
Thursday.
be fun.
Yeah.
No, no,
Yeah.
no. Yeah. Wait. A week from Thursday. Wow.
Yeah.
Jeez.
It's coming up fast, man.
I gotta remember what day it is. I saw this meme today. I'll just leave you with this. It's like from like December 1 to the 25th, like you're just festive and happy. And then from like December 26th to like January 1st, you're like, you have no idea what day it is.
Right.
And I think that's
Absolutely.
exactly where I was just now. Cause I added like 14 days to Thursday and I was like, cool, that's January 8th.
Yeah, man. It's this time of year and like
Ugh.
the entire winter, especially in the northern parts of the country where we're at, like it all just blends
Oh, man.
together. Like it gets dark at 4:30. You have no idea what day it is.
Yeah.
Owning and operating your own business like us, like
Yeah.
every day is a work day.
We're coming out of that now, right? The other day was the longest day of the year. Now
Yep.
now we get in it,
Shortest.
right? Or something
Shortest
like
day
that.
of the
So
year,
yeah, oh, shortest day of the year. Yeah. So now now we're on the uptick.
We're on our way through, man. Well, it's been great having you. I can't wait to
Thank you,
tee it
brother.
up in golf with you down in Mexico, right? Because you're gonna bring that awesome golf swing down to Mexico.
Bombs.
Bombs. For those who aren't already following Joe, where can they find you on the Instagrams, websites? In New York, where are you at?
Yeah. So on Instagram, I would say that the two best places to sort of learn a little bit more about what we were talking about today would be Strength in Motion underscore PT or at Join Fringe. Those are two of the easiest sort of social media tags to jump on in and follow. Same thing for the website. You can follow me there. The clinic that I work at is located on 20th and 5th in Manhattan. That's right in Midtown. I'm at a beautiful space called Encore Fitness. And yeah, if you peruse my website, you'll have my email address, my cell phone number, all that good stuff. So if you really want
Social
to get a hold of me, I'm
security.
very, very easy to find. Yeah.
Yeah. You're an easy person to follow. So, but awesome, Joe. Well, have a great rest of your day, and we'll chat soon.
Thank you again, Rita. Really appreciate you having me on.